All right, welcome everyone. Welcome to day 3 of MAB, the 13th annual Magical Aesthetics Bazaar here at Empire Eye and Laser Center and Empire Aesthetic Center. We're very excited to have you joining us for our third day of live streams, also our last day of my live streams. We do have a lot going on tomorrow with our in-person social event, and Friday we'll kind of be wrapping things up. But we have 3 exciting sessions for you starting right now. In a moment, Chelsea and Melanie are going to talk about Ultherapy. But first, giveaway time. So we're going to give away actually at the end of the session. What it's going to be is a free Ultherapy Brow Treatment. And you'll learn more about Ultherapy and the various ways that Ultherapy can be used in a moment. If you do want to be entered for a chance to win that Ultherapy Brow Treatment, go ahead and leave your name in the comments, whether you're on Facebook, YouTube, or if you're joining us on the behind the scenes camera on Instagram. Go ahead and put your name in the comments and we will put you in our wheel of names so we can draw the winner at the end. Also, any questions that you have for Chelsea and Melanie, make sure to put those in the comments as well, and we will get to those when we get toward the end of this session. So I'm going to go ahead and hand it over to Chelsea at this point. Chelsea, welcome.
Hello everyone. I have Melanie here with me. We're going to be going over Ultherapy today. So first I'll start out by just going over the Ultherapy Rejuvenation Package. The regular price is $46.60, and only during MAB it is on sale for $2,500. And you also get 30 units of Dysport and a BBL. So great deal there. Okay, so starting out, we're going to start out just going over Ultherapy. Melanie, I did her treatment about 8 weeks ago on her lower face, neck, and chest. So later on in the presentation, she'll tell you about her results and her experience with that. So Ultherapy is a non-invasive treatment, and we use ultrasound technology to help increase your collagen production and elastin. You get natural looking results without surgery or downtime, which is amazing. I've been super impressed with patients that I've done Ultherapy on so far. Everyone's really loving their results. We do it in 2 appointments, and it's so nice that there is no downtime and it's totally non-invasive. So Ultherapy is kind of unique. There's really no other technology that allows you to be able to see the structures in the skin and treat exactly where you want to go. So you can personalize it. It is safe and effective. It does allow us to go deeper than other treatments like lasers or radiofrequency, and you will see a visible lift and tightening in the skin.
I think the fact that it's really precise is what's so key with this, that there's not a lot where we can actually visualize under the skin what we're doing. We learn the anatomy, we know what the structures of the skin from the bone up to the surface look like, and we know when we do treatments with neurotoxins or fillers or threads where we're supposed to be placing things. So I wouldn't say it's blind, it's definitely coming with a skill level and a knowledge and training and education level to know what you're doing. But to actually be able to see what you're doing with the ultrasound technology really leaves little room for error, essentially.
Yeah, I know. It's pretty unique. I love that. Okay, so we'll just go over, kind of talk about the skin, and we'll talk about the building blocks of the skin, which is we're going to start off with collagen. That's kind of like a lattice work in your skin that is going to provide structure, and like it's more of your deeper structural support found in the dermis. Elastin, I know we talk about collagen and elastin all the time, but elastin is another very important factor to the skin. It helps the skin stay firm, bounce back, and not sag. Also, another important factor of the skin is hyaluronic acid. It's found in the dermis where the collagen and elastin intersect, and it aids in moisture retention and provides firmness. As we age, these 3 building blocks kind of break down, and that's where you can see the photo on the right there where that aging begins.
I think you're right that it's interesting for you to say, we say these words all the time, and we know darn well what they mean, as we should for what we do for a living, but to really, for you to understand, when we're picking treatments, we're addressing these things in your skin, and a lot of what we do, at least with skincare, Ultherapy, our devices like microneedling, lasers, and IPL. The collagen is really what's breaking down, and we're trying to correct to give you a lift of the skin. The elastin, I think, should be easy. If you've not thought of this before, you can think of it now. Think elasticity, elastic, something that's got some stretch and bounce back. If we pull the skin, we want it to be able to bounce back to where it's supposed to be. We shouldn't pull it and just see it kind of hang and sag for any amount of time before it bounces back. That sag is that we're getting on the jawline and everything drooping is a lack of elastin in the skin. So it's important that our treatments are trying to regenerate and rejuvenate both collagen for lifting, elastin for elasticity, and hyaluronic acid, of course, is not something addressed by Ultherapy necessarily, but is, you know, for the moisture content in the skin.
Yeah. Okay, so this is just going to show kind of another, kind of like a pictorial dictation of the role of elastin and collagen. So it just shows the collagen can become impaired by intrinsic or extrinsic factors. So basically what that means is natural aging process can impair our collagen, or more extrinsic things like sun exposure, smoking, air pollution, diet, those type of things.
Genetics fall under the intrinsic category, illnesses and things like that that can affect our aging process as well. So there are some things that we have control over and some things that we don't. So we absolutely should control the things that we can.
Right. So this causes the infrastructure of elastin and hyaluronic acid to weaken, and as a result, we lose elasticity and our ability to hydrate. Okay, so it is, Ultherapy is FDA cleared to lift the skin of the neck, chin, and brow. Also, we can treat around the mouth, and it just doesn't say it, but we can treat the décolleté as well. Basically, this just shows the weakening collagen fibers, which start to make wrinkles and sagging develop. We do use ultrasound technology to trigger your body's own natural regeneration response that stimulates growth of new collagen and elastin. And you will end up with a lifted, tightened skin up in about 3 months, and then results last for up to a year or more, and usually you'll see those results within 3 to 6 months. Okay, so this just talks about how Ultherapy is going deeper than other treatments. And this kind of gives you more of like a visual aid where you can see what's kind of happening here with Ultherapy. You can see the epidermis and the dermis there. And as we do the treatment, you get cell proliferation, you get more collagen and elastin fibers, and you also get additional fibroblasts, which are just basically skin cells.
And this whole cascade is something that as healthcare providers we're very familiar with. So what we're doing in aesthetic medicine is trying to manipulate that response to get a response that we want and get a result that we want to achieve.
Right. Okay, so this is going to be just a video for you guys to watch. It just kind of does an introduction to Ultherapy.
With age, skin loses its elasticity, and the signs of aging become more visible. Beneath the skin's surface, structural proteins such as collagen and elastin fibers stiffen over time. This leads to a decrease in skin's elasticity and contributes to the sagging and the forming of wrinkles. Ultherapy is the natural choice for a non-surgical way to lift and tighten skin using safe, time-tested ultrasound technology, and is backed by 4 unique FDA indications and research from over 50 clinical trials. Using micro-focused ultrasound, along with its proprietary deep-sea ultrasound visualization, Ultherapy delivers energy to where it will be most beneficial, leading to a lift of the neck, chin, and brow, and can also improve wrinkles on the décolletage. Ultherapy reaches the same deep tissue layer as surgical facelift addresses, but without surgery or downtime. During an Ultherapy treatment, ultrasound waves are micro-focused at the precise depths in the dermal and subcutaneous tissue, sparing the skin's surface and intervening tissue. Friction heats the tissue to between 60 and 70 degrees Celsius, forming thermal coagulation points at depths of 1.5, 3, or 4.5 millimeters. Delivery of ultrasound energy in this manner causes contraction and denaturation of collagen and initiates the body's healing response, resulting in collagen synthesis and tissue repair. This new collagen growth leads to natural-looking results that accumulate gradually over the course of 2 to 3 months, with visible improvements that can even be seen a year after treatment. Ultherapy is the first and only FDA-cleared procedure to non-invasively lift the eyebrow, neck, and under the chin, and is also FDA-cleared for improving lines and wrinkles on the chest.
All right, Chelsea, we're back.
Okay, perfect. All right, so that kind of went over how Ultherapy works and what you can expect from the treatment. This here is just going to show us kind of another photo representation of where you can see the surgical facelift goes deep into the muscle. The lasers go kind of shallow there at only 1.5 millimeters. Radiofrequency goes in kind of at an unknown depth. And then the ultrasound, you can see, treats all layers. So we are getting like that top part of that muscle there, which there is collagen and elastin kind of built like a sheet that attaches that to the dermis. And so we are getting 3 different levels there. And the interesting thing is we're all different. So all of our skin thickness is different, our collagen amount is different. So the nice thing about Ultherapy and this technology is you really can see in the photos, you're able, not the photos, but the image, the ultrasound image, you're able to see like actually where the epidermis, dermis, and muscle is. You can also see structures to avoid like blood vessels or bone. So you're not just treating blindly, you're actually really getting it individualized for the patient. So you'll see here this transducer is what actually clips onto the hand piece. And they are disposable, and each transducer contains 2 ultrasound elements. So we have the visual aid here on the left, which shows the skin structures there. And then we also have the ultrasound waves that are transmitted to that little pinpoint of, it's actually a microscopic injury that's made to the tissue. So the ultrasounds, basically they send the waves through a water-rich substance. We apply a gel to the skin that allows us to smoothly glide over the face. And those little micro injuries are made usually at like 2 to 3 different levels, and that's where the healing occurs. There we go. Okay, so this next video is going to be kind of a depiction of what Ultherapy is doing. That ice block will represent your skin, and those little dots that you see at 3 different levels are going to be those micro injuries.
That's really cool.
That's cool, right?
I haven't even seen this video. That's awesome.
And they look more apparent. They are actually microscopic, which is pretty neat, but
Yeah.
it's very zoomed in. Okay, so here's some before and afters. So this is going to be focusing on the brow. 86% of these patients in this clinical study did see significant brow lift. You can see the first patient in that top corner, you can see how much skin is actually lifted there. You actually can see more of her brow bone now. Gonna be much better when she's putting on makeup. And then you can see the patient on the bottom there. She's maybe more aged than these other ones, so her skin is thinner, but you can see that she still has really good results. Okay, this is gonna be some before and afters of under the chin. I really love these results because I feel like it makes such a big difference just in your general appearance to really improve that skin under the chin there. This is going to be of the neck. That's one of the areas that I feel like is the most difficult to treat. And it's where we really notice aging a lot, because I feel like a lot of us forget, like me, to put sunscreen on my neck. So it's like in, a matter of time, I'm going to see the same aging. So it's great that we have this technology. So 74.5% noticed improvement. And you can see really significant improvement in all of these patients in lifting that little turkey neck under there. And then this is some before and afters of the chest. So this really helps with those vertical lines on the chest, and I mean, just like that general kind of like sagginess that you get to that area. This is 90 days. 85% of the patients saw improvement at day 180.
So I want to point this out because we talk about the neck. We talk about the face the most. We talk about the neck the second most, and the chest third before we talk about other body surfaces. But I think that a lot of people don't realize that as much as we say we should use multiple modalities to address the skin on the neck, that one thing's not going to do it all. It's the same with the chest. So each of these patients are experiencing a lot of those lines that they're seeing because of sun exposure. So the number one thing, of course, you can do to help prevent you getting to this spot is sunscreen. But many of us are either already there or have had so much damage before we started applying sunscreen that damage is going to come on anyways. Or we're side sleepers. And even though I'm going to tell you to sleep like a vampire on your back, the reality is that we also need to get good quality sleep. And if that means sleeping on your side, then go ahead and sleep on your side. For me, this is an area I do apply sunscreen. I get treatments on my neck and chest. I have done a number of treatments, but Ultherapy has been my favorite for the lines. Certainly, photofacials, IPLs are going to get rid of pigmentation and brown spots. The skincare and the sunscreen is going to help with the tone of the skin, and sunscreen is going to help prevent me from getting to, say, the pictures on the right side. But I am a side sleeper, and I have been for many years, and I've done Ultherapy twice on my chest, but it's been many years apart. Favorite treatment that I've done for my décolleté to be able to help with those lines. You did my treatment how long ago? Time flies.
I know, it really does.
Maybe 2 months?
Yeah, I want to say 8 weeks, but
so
it
around,
could be longer.
Yeah, and you guys might remember because I know I posted a funny video about it, but a few months ago I had my treatment, and I'm still in that recovery period where the results are going to continue to come on, but I definitely can appreciate what it's done for my jawline and lifting here, my neck and under my chin. I'll need to lose a little weight under here, but I still see improvement. And then the lines on my décolleté was probably my favorite one because those are the hardest things to treat. And this is one of the few treatments that's going to have a significant impact on those lines. It's not a be-all, end-all, but it is something that IPL is not going to address those deep-seated lines the way that Ultherapy will.
Yeah, I love it.
I love it too.
Okay, so Ultherapy is a proven treatment. It's natural looking, it's long lasting without surgery. It is totally customizable. Once again, I want to repeat the no downtime, which is one of my favorite parts about it.
True, because we wouldn't advertise that this is going to replace what surgery can do. Absolutely, a surgical facelift is going to be a more significant result. But we work, we're busy, we have lives, we don't have downtime, and so this is a really great alternative.
Yeah. Usually we split this treatment up into 2 appointments, so it's like 2-hour-long appointments. Sometimes we will offer some pain control with the nitrous, which you probably saw in our video. But usually most patients don't even really require that. We do numbing before, so you come in 30 minutes before and we numb you. And then you'll see your results 90 to 180 days, and they'll last up to a year or longer. And I do just want to point out, this one is one that we want to kind of plan a little bit for, because if you're planning on purchasing other treatments like PDO threads or filler, we want to kind of space those out at just the right treatment plan for you. So keep that in mind. Okay, and that's it for Ultherapy presentation. Once again, our pricing is great during MAB. It's $2,500, and you'll get lower face, and then you can either choose the neck, around the mouth, or the upper face. And then you also get those 30 units of Dysport and a BBL.
It's great pricing.
It is good. I like it.
All right, thank you so much. We do have a few questions, if you don't mind touching on those. So specifically the Ultherapy Brow Treatment. What essentially is that doing? What are kind of the results that they can expect from something like
Okay,
that?
so depending on what I see in the brow, I'll do a treatment either just on this lateral part where you get kind of that raised arch appearance. We can also treat some more here in this area where then you get like a whole brow lift of the whole area, but it's kind of depends on what the patient's wanting.
Does it do anything for the eyelids, the upper eyelids?
Not specifically.
Not really.
So if our eyelid skin is heavy and we pull up the brow, that certainly does pull up a little bit of that eyelid. So it's great to see some improvement there, but depending on how droopy the eyelids are and how much skin is hanging there, surgery is really the only thing that's going to remove the excess skin. So yes and no. If you have a light amount of skin, then pulling up the brow is going to help, certainly. But if you have a significant amount of excess skin, you're going to need surgery.
And you can probably see in the mirror when you look at yourself, if you do like what I did and you just slightly pull up right here,
Yeah.
if that helps you and you like the way that looks, then
Yeah.
this will be a good treatment for you.
And slight. Ultherapy really
Slight.
cannot take your
It's
brow
not.
up into your hairline. People have been concerned in the past that they're going to look too wide-eyed and overdone, and it's really not possible. So, but it's that slightness that makes such a significant difference for most people. So make sure that for what you're wanting with the excess skin, that slight improvement is going to do it.
And how many treatments do folks generally do to get results, or is it, can you see results after one treatment?
So we do split it up into 2 treatments, which are spaced a month apart. After that second treatment, they'll start to see results 3 to 6 months, and then that can last about 1 to 1.5 years. Other areas that are smaller, like the brow, under the eyes, around the lip, we might just do it in the one appointment just because it is so fast. But it kind of depends on the area.
Yeah. It's technically one treatment that we're treating multiple depths. The reason we split it into 2 visits is because otherwise it's a very long treatment. So we're doing different depths at each treatment, but it's really kind of ultimately could be done at one time. So we split it up. So you're only purchasing one price. You're not having to purchase that twice to cover both treatments. I hope that makes sense.
And then can you clarify for folks, this is different from BBL/IPL, and then also they wanted to know, each of you, how many of these treatments have you had yourself?
Okay, so this is very different than BBL or IPL because this is using ultrasound waves to actually cause the damage, where BBL or IPL is using light therapy. And the BBL is more addressing like pigmentation, redness, rosacea. I mean, you do get some like skin rejuvenation from the BBL because it is anti-aging and turning on anti-aging genes.
But not lifting.
So the Ultherapy is going to be where you get more of that lifting, improving skin laxity.
But conversely, the Ultherapy is going to have 0 improvement for redness, pigmentation, pore size. They're 2 very different treatments. That's why it pairs well in the treatment package here. As far as how many treatments we've done, I've done 3. And actually, I'm just going to very humbly and honestly say this right now. Chelsea did my most recent one, and it's the best treatment I've had, the fastest results that I've been able to appreciate. I was really impressed with the way that she performed the treatment for me and with how quickly I was able to see results. So thank you for that. Yeah. That was a really good one. She's got the most up-to-date training and is doing things a little differently than I had been trained in the past. Because in medicine, in any branch of medicine, including aesthetic medicine, we learn how to do things better and better as time goes on. And so this is why we stay current with trainings and education so that we can always know it's the most current recommendations.
All right, thank you so much. That's gonna about do it for the questions today. We do want to get to our giveaway here before we get to our next session. So thank you so much, Chelsea. Thank you so much, Melanie, for your time today and talking about Ultherapy. And so let's go ahead and see who's gonna get to try this. Who's gonna get to try this Ultherapy brow treatment for free? So I'm gonna go ahead and get this wheel pulled up for everybody so you can see who is going to be our big winner today. Here we go. It is spinning. And it's going to be Sarah Douglas. Congratulations, Sarah Douglas. You are our winner. Not sure if you're on Instagram, Facebook, or YouTube, wherever you are. Email us, info@empireeyeandlaser.com, so we can connect about getting you your prize. info@empireeyeandlaser.com, so we can connect about claiming your prize. So again, thank you, ladies. Thank you, everybody, for watching, and come back here in a few minutes to learn more about LASIK. You're doing all this great stuff for your face. In our aesthetic side, make sure your eyes are also the best they can be. So LASIK can certainly help with that. All right, we'll see you again in a few minutes. Bye, everyone.